The United States has surpassed 250,000 deaths due to COVID-19 caused by the SARS-CoV-2 virus. Hi guys, welcome to this channel. I'm here to make sense of the coronavirus situation that's happening around the world in the United States. I have worked in the healthcare industry for over 20 years and have worked with epidemiology data. So today I want to take some time to look at the data and help make some sense of everything we're hearing on the news and all over the world. Let's start with the Johns Hopkins Coronavirus Resource Center. This is one of the best sources of coronavirus tracking data we have for the United States as well as for around the world. Most news media outlets, many online outlets use this as the base source of data. So today is November 19th, 2020. In the United States, we are at 11,710,000 cases of coronavirus as of today. And of that, 252,484 deaths due to COVID-19. Around the world, so we unclick the US, we are at over 56,817,000 COVID-19 cases and surpassing 1,358,000 deaths globally. These numbers seem daunting. Let's take a look at another visualization of the data. I will put links below to the sources of data used. This 91divock website utilizes the Johns Hopkins University data, but creates a visual picture of the coronavirus cases over time. So this first chart can track different metrics related to the COVID-19. Here we're showing new confirmed COVID-19 cases per day since the start of a rise in cases after a certain threshold. So here we see highlighted the United States. You can clearly see today is day 0. You go back 259 days and you see cases at that first peak in the March time frame. Come down a little bit, have a second peak in the June-July time frame, come down, and now we are in the midst of increasing COVID-19 cases yet again and at a much higher rate than before. What we can also do here is you can add an additional highlight country or region, and there has always been comparisons to the European Union, so let's highlight that here. Then you can see the European Union in orange, while there was a similar peak in the March timeframe, April-March timeframe. There was not really a second peak when the United States hit that peak in the July-August timeframe. However, in the European Union, COVID-19 did come back quite strong in early November and late October, early November. And it looks like it has somewhat peaked now as of a week or two ago and has come down slightly, although cases are still amazingly high as compared to the United States, although the United States is growing quite rapidly. What's useful for this website is you can animate the data from the start, and this will show that as the European Union was growing in the beginning of March, the United States took a little bit of time before it started, but by April 1st, the United States was catching to the European Union, and just after the first week of April, the United States surpassed the European Union in total cases. Here you see the European Union start coming down, in the May timeframe, as well as the United States, although the United States hovered at roughly 20,000 new cases per day, whereas the European Union was able to come below 5,000 new cases a day. And as the European Union stayed at that lower threshold, the United States started increasing yet again through July and into the middle of July at that second peak. Around the end of July towards almost August, you see the United States hitting that second peak at over 65,000 new COVID-19 cases per day. In the meantime, India was increasing their first wave at this time. You can see that in the background. Now, as the United States came down through September and restrictions started relaxing, this is when the European Union started going up yet again. As we approached the end of September into October, both regions, the European Union as well as the United States, started increasing cases yet again, with European Union increasing at a much faster rate this time around. Now, as we move into November, the European Union cases are skyrocketing, while the United States showed that initial increase. And as we get into the first week to the second week of November, now the United States cases start skyrocketing as the European Union starts plateauing and potentially coming down until today. So that's one way to visualize how the cases have evolved over time. What we can also look at is, instead of new cases at a 1 week average, we can look at new deaths. And here the picture is a rather stark contrast between the European Union and the United States. Both regions saw a spike in deaths in the April to May timeframe, with European Union seeing a peak of over 3,000 deaths per day, and the United States seeing a peak of over 2,000 deaths per day. Both regions, in terms of deaths, started lowering into the June through August timeframe in the summer. However, in the October timeframe into November, we see a second spike of European Union deaths. Those deaths have now matched the death rate of April at over 3,000 deaths per day. Whereas the United States has also seen a recent increase in deaths, and it is still on the rise, although it is currently just over between 1,000 and 1,500 deaths per day. So hopefully this gives you a perspective of where we are with the COVID-19 trend. It is by far not over. Looking back at the new cases, thinking about what we were doing in that April timeframe, what then led to a spike in the July-August timeframe, and finally where we are today. Let's learn from the past and understand how we can bend this curve back down towards a resolution of the COVID-19 pandemic. Thanks for watching. Please stay safe, wash your hands, social distance, and wear a mask. We're all in this together. Thank you.